Good afternoon. It's a privilege to be talking to you folk. So that's the topic for today. I like those two words because I feel they are exactly what is needed. Resilience means the ability to change without losing your character. And relevance means doing what is needed and not necessarily doing which is profitable. So they are two very good words. The secret of relevance, Kalbat said, you should take your Bible and take your newspaper and read both, but interpret newspapers from your Bible. That means you interpret what is happening in the world or what is happening in your country based on what you know about the biblical history. You don't interpret the Bible based on what you see in the newspaper. I hope you understand the difference. All I'm trying to say is it is important to know the context in which our country is today. So you will know what is relevant, what is needed. So what is the current context? We all know that the GDP has grown wildly. It is the third or fourth, is the fourth country with the highest GDP, all that. But the per capita income is the lowest in 20 years. Now, what does that mean? That means the disparity has increased. The difference between the rich and poor has increased greatly. Unemployment has doubled in the last 10 years. Household debt has increased. Healthcare spending is pathetic. It's the lowest in the world. They spend even less than 2.5%. Most countries will spend 8%, 10%. 75 million people go below poverty line each year due to many causes, but the most important is health. It's called catastrophic health expenditure. That means if your child suddenly falls ill and has pneumonia, you admit the child in the ICU, and then the child stays there for 5 days. And then the ICU bill comes to 3 lakhs or 4 lakhs. And then in trying to pay that, you have to sell off your field or your cows or bulls, and then you don't have any livelihood left. So that is the meaning of catastrophic health expenditure. To believe that 7.5 crore people, that means close to 5-6% of India's population, are submerged into below poverty line each year is a very sobering thought. 25% of children who finish 8th to 10th standard can barely read. This is from the Pratham Foundation. You will not find this in the government statistics. That means the future is dim for 25% of children. And 25% is a lot of children. That means they will not get a job. That means they will continue to be poor. That means they will not be able to access healthcare. Tertiary care and private care is growing phenomenally at the expense of primary and secondary care and the public health system. The public health system is growing only in the southern states. In Kerala and Tamil Nadu, it is especially good, but in the other states, it's not been growing. And the worst feature is inequality is the highest in 100 years. This is based on the World Inequality Database. Now, you may not know the consequences of inequality, but the consequences of inequality are absolutely grim. They not only affect the poor, but they also affect the rich. inequality produces mental illness in the rich. Did you know that? It affects everyone. And this is why in the Bible, we have the Jubilee years when to prevent severe inequality, you had the Jubilee year when the slaves were set free, all debt was cancelled, and the land was given back to the tribe. So the God of the Bible knew that inequality will have serious consequences. And so we are a country where we have the highest inequality in 100 years. Okay, now understanding the gaps. I had a report yesterday from our missions department that they had visited Kerala hospitals. And I always thought the Kerala hospitals were floundering and they had become irrelevant because there was so much competition. But he brought back some glowing reports that they have, what they have done is they have positioned the hospitals all in the gaps. They have mission hospitals that are full of mental health wards, geriatrics, and chronic kidney disease, dialysis wards, disability. And so, and a lot of them are self-sustaining because they have been supported by the church. In the olden days, the church was taking money from the hospitals, and now it has become the reverse in Kerala. The church is raising money not only from its members, but from other businessmen and funding the mission work, and the hospitals are doing extremely well because they have understood the gaps. 62, I was telling you about mental illness. It's a big gap. There are 60, 70 million people who suffer from common to severe mental disorders. I'm not simply talking about depression. I'm talking about more severe mental disorders. And 6 to 7 million people are a lot of people. I don't think we have enough psychiatrists to manage this load. And I don't think people are really interested, the private sector is interested in the mental illness because there may not be too much money in it. But this is where we can come in, definitely. And then India is also the suicide capital with all those numbers. 11 for every 100,000 people commit suicide in India. Why is that? It is because of inequality. NCDs contributing to 60% of deaths, non-communicable diseases, and 4 of them are mainly important: heart disease, cancer, diabetes, chronic pulmonary disease. And they are all sort of interrelated. And again, these NCDs in itself, they have a primary component, they have a secondary component, and they have a tertiary component. The private sector is only interested in the tertiary component of heart disease. They are only interested in the tertiary component of cancer and diabetes and chronic pulmonary disease. They are not interested in the primary and the secondary factors that cause NCD. So again, this is an important gap. The private sector is mushrooming. Out of 75,000 hospitals in India, 45,000 belong to the private sector. In Vellore itself, even though CMC Vellore has got 7 campuses, there are more than 100 or maybe 200 nursing homes and small hospitals. In spite of that, the day CMC opens shop, they get flooded. And now this is something that we have to learn from. And the learning from this is very simple, that they trust the ethos of CMC. And so if you create an ethos of trust by working for 7, 10, 15 years, then people will come to you because they trust you. And that is very important learning. The strategy, our strategy should pursue relevance wherever it leads. That means we have to do what is needed. We should not do what is most profitable first. If what we want to do is both relevant and profitable, that's actually good. But we don't simply pursue that which is profitable. We pursue relevance wherever it goes. And when you say wherever it leads, what will happen is that it will lead to things that don't actually contribute money in the short term. I will talk a little bit more about this. And then the current strategy should be that we form seamless partnerships. In the olden days, 200 years ago, 150 years ago, hospitals and schools and vocational training, they all were often started together or very soon after. If you see some of the leprosy mission hospitals, they have hospitals and vocational training components. A lot of the mission hospitals have hospitals and schools going together, and there is logic in it. I will talk about that soon. And then the other strategy is innovation, embrace technology and the use of alternative human resource. Now, we Christians can shy away from technology, but we must remember that AI is both good and both bad. You can use AI to bomb countries out of existence, and you can use AI to educate children and feed children and make a nation prosperous. And if we don't use technology, then we will leave it to others who will misuse it. So we should embrace technology. And then leadership development, visionary leadership development, leadership that is always asking, what can I do, Lord? How can I change? How can I make an impact? How can I help the poor? How can I change the nation? We want people like that who are constantly asking those questions of each other and of themselves. We should initially start with primary and secondary care done by family physicians, and we should have satellite clinics manned by family physicians, nurse practitioners, and physician assistants. And we should manage the gaps in healthcare, the gaps that I mentioned. I think this should be a first focus. And if this is done well, you will be able to add other components as you go along. If you start with these, because they are initially inexpensive, it is not going to be a big drain on the hospital. And then what they have to do is pursue relevance, and I will tell you how partnerships will help pursuing the problem of relevance. Relevance means inevitably the poor, disabled, the neglected. Inevitably, it means a financial burden. But what will happen is, once a lot of poor people begin to come to a hospital, the hospital inevitably gets an aura. It becomes hallowed because God resides in the midst of the poor, And so if a lot of poor people begin to come to a hospital, even the rich people feel there is something special about that hospital, and they begin to come there. And so we should not be ashamed if only a lot of poor people are beginning to come. And this is the most important slide. Now, this is not the time to work in isolation. And I will tell you why. We have to work with the education sector. We have to work with the livelihood sector. We have to work with the government. We have to work with the church, and we have to work with the community. And if you're able to do all of these things, you will find you're in the very center of all that is happening, and you become extremely relevant. Now, I will tell you how this will affect us in the long term. Now, if you invest in education, vocation, and primary care, the three most important components in development, education, vocation, and primary care, you invest in the community for 7 years, the community will begin to prosper. In simply a matter of 7 years, the child finishes 12th standard, and if you're helping with education, he'll be very well educated. He will at least get a good vocational, training and get a good job. And then they will be able to pay for the healthcare, and it will begin to make your institution sustainable. The most important social determinant of health is education. Education is the most important vaccine, so to speak, against ill health. If you don't do anything and only do health, you will actually change the health scenario of the country. I mean, if you don't do anything, do only education, you will change the health scenario of the country. Now, there are lots of very good things that are happening in the education sector. There are micro schools, there are e-schools, there is remedial education. All of them can be done without government approval and can be done without big buildings. It can be done in church halls. It can be done in empty community buildings. And this is the link for the micro school directors program, education. And they will you can not only learn how to do micro school up to 1 to 5, but also you will be able to get gadgets. Gadgets means a tablet to be able to give the children, to be able to do education. Now, the government of India has got this website. I was absolutely shocked to see this website. It offers teachers, students, and parents learning material relevant to the prescribed school curriculum. It has got CBSE curriculum. It has got matriculation curriculum. It has got vocational training videos and curriculum made in the form of e-learning. I'm not sure if you have seen the textbooks made by the distance education department on diabetes and family medicine and psychiatry and geriatrics. Diksha has produced materials exactly like that from 1 to 12 for CBSE, 1 to 12 for matriculation. And all you need to do, it's free, available free of cost. All you need to do is put a TV screen in the church hall, collect students, and get Wi-Fi and go on to the teacher will begin to teach, the teacher will ask questions, the teacher will show videos. You don't have to do anything, you have to just organize it. And so we have access to this. And to be able to do that, this is called homeschooling. To be able to do that, you don't need government approval. You don't need to pay bribe and wait for 3 years to get clearance. And you don't have to have half a dozen football fields. And you can get permission to start. You can begin to educate children. They will be able to pass exams, especially if we people get involved, because we don't have to do anything extraordinary. We just have to do what we do normally, which is some honest work. So I was telling you about all this training. Now, why am I telling you about this? Because if our mission hospitals, which are in the rural areas, if they develop the capacity of the community in livelihood training and in education and in allied health training related to livelihood, and also provide primary, secondary care, that community will own your hospital, will trust your hospital, and it will become almost like their worship place. And so you will be able to add to what exists. You can add tertiary components, you can add more and more specialties as you go along, and it will become sustainable. I'm just, okay, Vocational Training Institute. Yes, all these things are also available free of cost. Government partnerships. We have the National Rural Health Mission and the National Urban Health Mission. And they have dozens of programs. I don't know if you know enough about these programs, but if you don't, you should get to know them. There are 9 programs in reproductive health, maternal, neonatal, child, and adolescent health. There are 4 programs under nutritional programs. Communicable diseases, there are 9 programs. And non-communicable diseases, there are 10 programs, which include almost everything: diabetes, hypertension, chronic kidney disease, elderly or geriatric care, blindness, burns, and tobacco. Now, church partnerships. I'm just saying this because we all talk about the Tamil Nadu effect, Tamil Nadu model, how healthcare in Tamil Nadu is so much better. And we often give credit to Periyar and Annadurai for the Dravidian parties. But actually, the story starts way back in 1715, when Bartholomew Ziegenbalg translated the Bible in Tamil. And do you know that the Tamil Bible was translated before the Malayalam Bible? At the time when the Tamil Bible was translated, in Kerala, they had only the Syriac Bible and the Latin Bible. And half of Europe did not have a Bible. And not only did Tamil Nadu have the Bible in 1715, they had a printing press that printed Tamil Bibles. Just not the New Testament alone, but both, Old and New. And that was circulated widely. And Pallikudams were started, and education happened, and education for girls happened. Women's education has a direct impact on health. And so women's education happened. And no wonder that Tamil Nadu today has the highest GDP in the country. And Tamil Nadu has one of the highest literacy rates next to Kerala and to Mizoram and so on. And also, Tamil Nadu has supported the Christian work in India in a majorly way. I worked with the Indian Evangelical Mission way back in the 70s and 80s. And during that time, 80% of the income of the organization of 200 odd missionaries in India used to come just from Tamil Nadu. And so I believe in church partnerships. I believe in preaching and teaching the gospel, because without that, you cannot bring about transformation. And I feel that leadership development is an important component, and you need a separate HR body to develop leaders and manage HR for mission. I guess this is what we are doing today, and we should continue to do that on a bigger scale and more regularly, so that we generate more leadership for mission. And we should never think of hospitals only as health, but we should think of hospitals as centers for health, education, and livelihood, because they all form a package. Because the biblical concept of healing is not simply the bodily healing, it is actually healing of the mind, which is education, and healing of the culture, which means livelihood and income generation. Embrace technology. There are lots of possibilities. I'm just suggesting some. A pan-India telehealth platform, diagnostic algorithms. I'm trying to prepare one for family medicine. Handheld ultrasounds. I think we should fight for ultrasound, the restrictions on ultrasound being lifted, because ultrasound is not simply a tool for detecting sex. It has got now uses for so many things. It's like a stethoscope. And so restrictions on ultrasound should be removed so that we can take it to homes. Nurses can take it to homes and begin to diagnose stuff. And then we should train and use alternative human resource for health. And then partnership with the government. Whatever the government is doing, we don't do things in competition, but in partnership. And what I'm doing now, I've started a home-based care company called Pisces, and I have more than 50 employees. I never thought I would have so many employees so soon, but I have 50 employees who are going to homes and doing stuff. And so, and I am almost 90% of the time able to pay all their salaries, and they all pray in the homes. And so actually I'm, what shall we say, running a mission agency, but it is a for-profit organization. And then you should always measure. You know, our health organizations and mission hospitals keep saying we are serving the poor. It's all right saying that, but can you measure and tell us how many people have come below the poverty line? How many thousands have gone above the poverty line? Because now you can measure poverty using the multidimensional poverty index. And so using that, you should be able to monitor whether your institution is doing well or not. You should have health indicators. You should have education levels indicators. And so you will know whether your mission, whether your hospital is making an impact or not. What is happening nowadays is, for so long, we, in our annual meetings, we just say, we thank God that we are serving the poor, but we have no metrics. And without metrics, you can keep bluffing and you can keep fooling yourself. But when you have metrics, you will really know what to do. And not only know that, you will be able to change strategy and know which strategy is working. So I've talked to you about relevance. You should put relevance above sustainability. I've talked about partnerships. I've talked about innovation and technology, and I've talked about leadership development. And in the relevance, I've talked about the gap analysis. I'll stop here. Thank you so much. There is lots more to all this than what I have said. But I think I was here just to start off a discussion. I'm sure there will be other people here like Priya, and there are others, senior people here who can also contribute meaningfully to this discussion.